Hello everyone. Today we will be discussing and presenting you our chosen medical devices, Flexpen, Tuberculin syringes, and Tracheal tubes. And in today's agenda, we will be presenting the three types of medical devices and explain and illustrate of the functions of these devices along of course with some of their components. And we will be also tackling the step-by-step demonstration on how to use these medical devices and lastly, the overview of additional information and counseling. So, Flexpen is a type of insulin delivery device designed for people with diabetes. It is a pre-filled disposable pen-shaped device. And this is how Flexpen looks like. And for its application, the Flexpen is used to manage blood sugar levels in patients with diabetes, specifically those who require rapid-acting insulin before meals or to correct high blood sugar levels. It is also used to manage hyperglycemia in hospitalized patients or during medical procedures where intravenous access is not available or practical. This enables convenient and accurate insulin self-administration. Parts of the FlexPen and its uses. So this is the first is the cartridge, and this is the pre-filled cartridge that contains insulin. It is inserted into the pen and secured with a snap-on cap. And the pen body, where the main part of the flex pen that houses the insulin delivery mechanism, and it also includes a dial for selecting the desired dose, a push button for activating the injection, and a viewing window to monitor the remaining insulin in the cartridge. The needle and the cap. The needle of the flex pen has a is disposable and it is also attached to the pen body. The needle length can be selected based on the patient's preference and injection site. As for the cap, this is a on cap that converts the cartridge when it is not in use. It also helps prevent contamination and accidental activation of the pen. And so the stepwise procedure are the following. First, you must prepare your pen, and second, you attach a new needle. Third, prime your pen, and then select your dose, give your injection, and finally remove the needle.
For further information, Flexpen is pre-filled with insulin or GLP-1 so you don't have to load it. The dose setting mechanism does not allow for a dose larger than that remaining in the pen to be administered, which causes correcting a dose by simply dialing back or forth, and that the dosing scale automatically returns to zero after your injection. The pen is color-coded for easy identification. The color green contains insulin detamere, which is used to treat diabetes in adults, adolescents, and children from the age of 1 year. The color yellow contains insulin aspart, a rapid-acting insulin used to treat adults, adolescents, and children over 1 year old who have diabetes. The color red contains liraglutide, used in addition to diet and exercise in adults and children from 10 years of age who have type 2 diabetes. The color purple or white contain insulin aspart, 100 units per ml, combined with protamine to make it longer acting. It is available as Novamix 30, which contains 30% insulin aspart and 70% insulin aspart protamine, which can be used in patients from 10 years of age. Novomix 50, which contains 50% insulin aspart and 50% insulin aspart protamine, and Novomix 70, which contains 70% insulin aspart and 30% insulin aspart protamine that can only be used in adults from 18 years of age. It is used to treat patients who have diabetes and need insulin to keep their blood glucose level controlled. Let me introduce to you the next medical device, which is the Tuberculin syringes, which is a small calibrated syringes specifically designed for the administration of small volumes of medication. It looks like this. For its application, the tuberculin syringe is used for performing tuberculin skin tests, which are used to diagnose latent tuberculosis infection and determine whether a person has been previously exposed to the tuberculosis bacterium. The test involves injecting a small amount of tuberculin solution into the skin, typically on the forearm, and observing for any signs of inflammation or swelling, which is the positive reaction, over a period of several days to several weeks.
Next we have is the parts of the tuberculin syringes and its uses. Firstly, we'll talk about the barrel. This is the cylindrical part of the syringe that holds the tuberculin solution. It is usually made of glass or plastic and has markings on it to indicate the volume of solutions being drawn up or expelled. Next, we have the plunger. This is the movable part of the syringe used to both draw and expel solutions from the barrel. It is made of plastic or rubber and has a threaded tip that fits into the barrel. Next is the needle. This is the sharp, hollow point at the end of the syringe that is inserted into the skin to deliver the tuberculin solution. It is made of stainless steel or other materials and comes in various gauges or thickness depending on the patient's age and body size. Next, we have the hub. This is the point where the needle connects to the syringe. It has a threaded tip that fits onto the plunger and helps prevent accidental dislodgement of the needle during use. Next is the application. In administrating tuberculin solution, we need to first locate and clean the injection site. It has to be 2 to 4 inches below the joint and should also be in an area free of barriers such as scars, sores, for placing and reading. Next is to prepare the syringe. Check the expiration date on the vial and ensure the vial that contains tuberculin. Next is inject the tuberculin. Slowly, insert slowly, bevel up at 5 to 15-degree angle. Next, we have to check the skin test. Wheel should be 6 to 10 millimeters in diameter. If not, repeat the test at the site at least 2 inches away from the original site. Lastly, we have is record all information. Record the information required for documentation by your institution. Next is our reading. First, we have to inspect the site. If it has erythema or the reddening of the skin, or induration, which is hard, dense raised formation. Next, we have to palpate the induration. Use our fingertips to find any margins of induration. Next is marking that induration, using our fingertips as guides for marking the widest edges of the induration across the forearm. Next, we have measuring the induration, not the erythema. Place the zero ruler line inside the left dot edge, then read the ruler line inside the right dot edge. Lastly, we have is to record the measurement of induration in millimeter. If no induration, record it as 0 millimeter. Do not record this induration as positive or negative, but only as recording of the measurement. Next, we have the interpretation. As we measure our induration, if the induration of the patient is greater than 5 millimeter, it is considered as positive in human immunodeficiency virus or HIV infected persons, people who have recent contacts with TB case, and so on. Next, if we have an induration of more than 10 millimeter, it is also considered positive in recent immigrants from countries with high prevalence of injection drug users. Residents and employees of the following high-risk congregate settings, such as prison and jails, nursing homes, hospitals, homeless shelters, and also included is the mycobacteriology laboratory personnel. If the induration is more than 15 millimeter, it is considered positive in persons with no known risk factors of tuberculosis.
For additional information, false positive reactions may include but are not limited to the following: prior administration of the Bacille Calmette-Guerin or BCG vaccine for tuberculosis, and for those who have received the BCG vaccine, a TB blood test is the recommended testing procedure in order to avoid false positive results. IGRAS or interferon gamma release assays are another name for TB blood tests. Next is mycobacteria other than Mycobacterium tuberculosis that cause non-tuberculosis infection, inaccurate response measurement or interpretation, and use of wrong antigen. On the other hand, some persons may not react to the TST even though they are infected with Mycobacterium tuberculosis. Some causes include allergy or the condition where the body is unable to respond to an antigen, recent infection with tuberculosis within the last 8 to 10 weeks, tested at a very young age for less than 6 months, recent smallpox or measles vaccination with live virus, incorrect TST administration technique, and inaccurate TST reaction measurement or interpretation.
And for the last device that we will be talking today, the tracheal tubes, also known as endotracheal tubes. This is a flexible tube that is placed in the trachea or the windpipe through the mouth or nose. So this is how it looks like, the one in the middle. The patient's airway can be secured using this, which is inserted either orally or nasally, enabling both controlled and spontaneous ventilation. This PVC used to make the single plastic tubes might be siliconized, ivory, or clear. This also contains a radio-opaque line running along its length, which allows its position to be seen on chest X-rays because plastic is not radio-opaque. The PVC that has been siliconized helps suction catheters slide through the tube. Before, rubber was utilized to make this, which allowed for reuse following cleaning and autoclaving. For its application, tracheal tubes are used during general anesthesia, intubation, and mechanical ventilation for patients rendered incapable of breathing independently. These tubes are indispensable for long-term airway management in patients with chronic respiratory conditions such as neuromuscular diseases, head injuries, or tracheobronchial tumors requiring prolonged intubation or ventilation beyond hospitalization or surgery recovery periods. They may also be used in patients with severe upper airway obstructions or difficulty swallowing due to head and neck cancer treatments such as radiation therapy or surgery. For the parts of tracheal tubes, first we have the cuff. This balloon-like structure, when inflated, seals against the outer cannula. When inflated, the cuff seals against the tracheal wall, ensuring that air from mechanical ventilation goes into the lungs and preventing aspirations of secretions. Endotracheal tube can either be cuffed or uncuffed. Next, pilot balloon, a small external balloon which remains outside after the patient has been intubated, connected to the cuff via a thin tube. It indicates whether the cuff is inflated or deflated or either leaking. The bevel. The bevel is a sloped edge on the end of the tube that helps guide it into the trachea during insertion. This helps easy visualization of the vocal cords during intubation and easy access into the trachea. And using endotracheal tube, first, hold the inhaler away from your mouth and fully blow out or you exhale. Next, keeping your head level, place the mouthpiece in your mouth and tilt the inhaler down towards your chin. towards your chin as shown in the picture. Close your lips around the mouthpiece to form a seal. Tilt the inhaler downward while keeping your head level. With your mouth closed around the mouthpiece, inhale deeply through the inhaler. Hold your breath for as long as comfortable and at the same time, remove the inhaler from your mouth. After holding your breath, exhale and continue the breath normally. For additional information, the patient's airway can be secured using tracheal tubes, either inserted orally or nasally, enabling both controlled and spontaneous ventilation. The PVC used to make these single-use plastic tubes might be siliconized, ivory, or clear, as stated a while ago. So that concludes this presentation. Given those numerous information, we therefore may say medical devices are considered a fundamental component of health system. The benefits they can provide continue to increase as they are essential to preventing, diagnosing, treating, and rehabilitating illnesses and diseases safely and effectively. We hope this topic become informative and purposive to you. We hope you will have a blessed and wonderful day. Thank you.